Hi, I'm Dr. Rohini. So today I'm going to talk to you about what are the ultrasounds that are done once your pregnancy test comes as positive. So first of all, we would be doing a scan once your pregnancy test is positive. We'll wait for a week or two, or else we will do a blood test called beta HCG. So once this beta HCG is more than 1500, at that time we would be doing your first scan. This scan would be a transvaginal ultrasound. So make note, the first 3 months it's advisable, and usually what we follow is we do a transvaginal ultrasound for the patients. So the first scan would be just to know whether the pregnancy is inside the uterus or not. It's an intrauterine pregnancy or extrauterine. So what is the significance? So if the beta HCG is more than 1500, we expect that there should be a sac, gestational sac, or the baby should be seen inside the uterus. If that is not there, then we label this pregnancy as pregnancy of unknown origin. So unknown origin means, why are we worried about this term? Because that means that the pregnancy can be in the tube, somewhere in the ovary, basically not in the uterus. And for a pregnancy to grow healthily, it has to be inside the uterus. So in case if it's in the tube, the baby cannot grow, and it will end up destroying or causing rupture of the tube, and which may cause lot of bleeding, and patient may even require surgery. So this is not very common, but since we know that there is a known complication like that, so it's better to be on the safer side. So we call up patients earlier and we just do a scan just to see whether the baby is inside the uterus or not. So now the first scan is over and we know that the baby is inside the uterus. Now next, we would call the patient again after 2 weeks, because it's unlikely at this point of time that the baby's heart rate will be there. So next we have to check whether the heart rate is there or not. So next we would be calling the patient again after 2 weeks to see if the baby's heart rate is good or not. So yes, so after the baby's heart rate is detected, next we would be calling the patient again after 2 weeks, that is around 8 weeks, and this scan is called dating scan. So in this scan, we will check the baby's measurement. We will be checking the crown rump length, that is the CRL. This measurement will be checked, and this will give an idea whether the dates are corresponding with the last menstrual period date that you have given, and it will help us to get the expected date of delivery. The date that is fixed at this point is the correct date, and it will be very useful for planning your delivery. This comes into play much more important when patients are having irregular periods. Sometimes they forget their dates and they are not very sure about, and at that time we fix their delivery date using this scan. So now our dating scan is done. So what would be the next scan? The next is a very important scan called NT scan, nuchal translucency scan. So why is this scan important? So this is the first scan in which we would start detecting whether there is any abnormality in the baby or not. So in basically NT means nuchal translucency, as I told you. In this we will be checking the neck fluid behind the baby's neck. So if it is more than a certain level, around more than 3 mm, then we consider that the baby is in high risk for developing many genetic diseases. Apart from that, at this point, we will also be seeing whether the baby's head is developed well, whether the skull bone is developed well, whether baby, it's one of the earliest scan where you can detect whether the brain development is good or not. We can also see at this point whether the heart is functioning well or not. So all these things give us a very good idea whether baby has any chances of getting genetic abnormality or not. So the NT scan alone would give an idea of about 80% whether the baby is having any problem. So, but this is a screening test. This is not a diagnostic test. Screening means that we can just tell you what is the high chances of your baby having a problem. This doesn't give you any confirmation. So once if you get high risk in this scan, according to this scan, then you would require to go further testing for this, because from this we cannot say for sure definitely your baby will have a problem. But yes, it will just give an idea. This along on the day of this scan, we would also be doing some blood test for you, which is called double marker test. So double marker test along with NT scan gives at least 90% idea whether the baby is having any risk of genetic diseases or not. All these scans are usually done for any pregnant woman, but when it comes to IVF, we tend to see patient a little bit more frequently, once in 2 weeks till the NT scan, and thereafter we see them once at around 16 weeks, because we also have to see during the scans whether the cervical length, that is the mouth of the womb, is of normal size or not. If it shortens, if it's less than 2.5 centimeter, there's a chance that patient can abort or go into labor early later on. So these are the important scans that is done during the first 3 months of your pregnancy. I hope I was clear. In case if you have any doubt, you can always reach us. Thank you.